The optimal time to place the cryopreserved amniotic membrane: any patient with recurrent corneal erosion who needs epithelial keratectomy, debridement, should also, in my opinion, be treated with the CAM immediately upon completion of that procedure, whether it's in office, under the laser microscope, or in the surgery center. Unlike a bandage contact lens, which simply protects the surface in a passive way to help the healing, the cryopreserved amniotic membrane confers this anti-inflammatory effect without inducing hypoxia, and it really actively helps the epithelium to heal. It's this regeneration, promoting cell growth and regeneration, that's key. It can also be used for RCE is associated with EBMD, which is not just a disease of the epithelium, but of the underlying basement membrane.